Okay, we weren't joking. It was very brief. So we will resume. I believe, Madam Administrator, we're all set, right? Thank you so much. This is a great opportunity to give thanks to all the people behind the scenes who helped make this day possible. We could not do this without you. So number 61, Jessica Chan was signed up. She is also unable to attend, and Trisha Orozco is here in her place. Welcome. If you can press the button right in front of you, that would be great.
Senator Anwar, Representative McCarthy Vahey, and esteemed members of the Public Health Committee. Thank you for this opportunity to offer testimony on behalf of Intercommunity Healthcare. My name is Trisha Orozco. I serve as the Vice President of Strategic Implementation. Intercommunity is an established community health center providing over 50 years of trusted and caring service to the greater Hartford community. We operate 9 school-based health centers in the East Hartford Public Schools and 1 in the Manchester Public Schools. As a federally qualified healthcare center, Intercommunity supports access to care and believes that all people have a right to quality healthcare, including minors. In Connecticut, the law states that minors can consent to certain protected services without parental consent. These services include HIV treatment, mental health services, in certain circumstances, abortion, substance abuse treatment, and sexually transmitted infection screening and treatment. Guidance from Connecticut.gov and other resources indicate that minors have access to reproductive health services. However, this is not spelled out in current laws. We are asking to codify current practice to include the rights of minors to obtain reproductive health care, including but not limited to contraception, counseling and services, pregnancy testing, and treatment related to pregnancy without parental consent. At 16, minors can legally consent to sex and receive sex-related treatments, yet the law is not clear around reproductive health care. We know that being a parent is one of the most difficult jobs, and if a minor decided to become sexually active, I would hope that they would seek guidance from their parents or guardian. The reality is that adolescents don't always confide in their parents or guardians. In fact, they often turn to their peers for advice. No matter who the teen turns to, we also want them to seek medical consultation and education from a compassionate and trusted medical provider. It is our responsibility to empower our youth to ensure that minors can make well-informed choices, which will position them for success later in life. In this testimony, we are asking for language clarity, which will ensure we as medical providers can support our minor patients in becoming responsible and healthy members of the community.
Thank you, and well done in the 3 minutes.
Thank
And
you. I had that
very-
timed.
Yeah, that's great, and very well said. We appreciate you being here. I'm sure Senator Anwar would like to comment or question. Senator?
Ms. Orozco, good to see you.
Nice to see you.
Thank you for all the work you and your organization do every day, and I appreciate you. And I think the compassionate care that you've talked about is something that's a cornerstone for the work that you are doing. It's not always smooth. That's the challenge, and you want this to this specific area to potentially at least be legally sound. And with respect to the smoothness around better communication and improving communication, that's an ongoing process on a case-by-case basis. Fair?
Fair.
Okay. We hear you loud and clear, and thank you for taking the time to be here, and sorry about the technical glitches you had to experience yesterday.
No,
So-
that is fine. I appreciate it. I appreciate all of your time. This is a very sensitive topic and a very important topic.
Thank you. Back to you, Madam.
Thank you very much. I don't think we have any other questions. Thank you for staying here with us today.
Thank you.
And we appreciate the opportunity to continue working with you.
Thank you.
Next up, we have Robert Hale.
Good evening.
Welcome.
Thank you for the opportunity to testify. Senator Anwar, Representative McCarthy Vahey, distinguished members of the Public Health Committee. My name is Robert Hale. I am an attorney in private practice. My home and my office are in Glastonbury. I have submitted written testimony, and I'm going to just try to ad lib and embellish upon my written testimony, and I hope I don't run out of time. So basically my concern, I'm testifying in opposition. Basically, my concerns relate to the definitions in the bill, the defined term services examination or treatment related to pregnancy and pregnancy prevention. It's pretty long definition. I have been listening all day to this hearing, and I wish I had time to correct many statements or fact check all the statements that have been made. But I think it was Senator Anwar who asked whether this definition might mean gender affirming care. In my interpretation as an attorney, yes, it might. There's nothing saying it does not include gender affirming care. As a matter of fact, the only thing it does not include is sterilization. So I think that's a very expansive definition and quite problematical. Anyway, the confidentiality, it's more than confidentiality, it's secrecy surrounding the provision of these services, whatever they are, to minors at any age, and expressly prohibiting notice to their parents, not just not requiring consent, but prohibiting notice to the parents is very, very problematical. I think the drafters of this bill basically wanted to totally deregulate abortion and have free reign to practice what they practice without any regulation and with no, really, it is not a protection for children to not tell their parents. Parents are the primary protectors of their children. You are putting these children at risk by prohibiting notice to their parents. Sex trafficking came up, and certainly a young girl who is being trafficked may be frightened, may not notify. Her parents are the only people that are going to be able to help her in a situation like that. Allowing a child like that to have an abortion with no notice to their parents protects the trafficker. It doesn't protect the girl. I know I'm ad-libbing and I'm almost out of time. I'm most concerned about the repeal of existing regulations. As I was researching for my testimony, I looked at statute 119A16, 119A16-1, and the regulations 19-13-D54.
Excuse me, Mr. Hale, but you've reached your 3 minutes. Thank you.
If you'd like to summarize, that'd be great.
Yes, please. A previous witness from Planned Parenthood testified that it is the goal of Planned Parenthood to completely do away with all the regulations. I believe these regulations are important. They are there to protect women and girls, and they go way beyond the ordinary standards of medical practice. It's been discussed that abortion is being treated as exceptional. It is exceptional, and it requires additional protections for women and girls, especially in relation to
Thank you.
I'm sorry, I just very conscious of time, with
Yes.
relation to informed consent.
Thank you. Thank you. Seeing and hearing no questions, we want to thank you for spending your time here with us today. We appreciate you and your testimony before
you.
the committee. Next, we have Chris Maddy. Welcome.
Thank you. It's good to be here. Good evening. Senator Anwar, Representative McCarthy Vahey, members of the committee, thank you for hearing me tonight on Senate Bill 1507. I've not testified before the legislature before, but when I saw this bill, I felt like I might have some experience to offer the committee as it's considering this.
Before you continue, may I interrupt and just have you introduce yourself to the committee before you go any further?
Yes, my name is Chris Maddie. I'm a lawyer in private practice, formerly with the U.S. Department of Justice as a federal prosecutor here in Connecticut. And my practice now focuses in part on representing patients who have been the victims of medical negligence, often due to systemic failures. But I also have a practice that investigates corporate abuse and corporate fraud. And so when I saw this bill being proposed, I felt it was important to come and support it because, in my view, private equity ownership of healthcare facilities is simply incompatible with the delivery of healthcare in the state of Connecticut. And let me explain why. Private equity is funded by capital investors who are expecting short-term high rates of return on their investments. These are high-risk investments, often by institutional investors who are expecting returns not of 5% or 10%, but 20%, 25% year over year. And anybody who understands healthcare knows that especially struggling hospitals are not going to be able to deliver that type of return for investors unless your purpose is not to provide healthcare. If your purpose is to loot those institutions by loading them up with debt or to deprive medical providers of critical infrastructure they need, or to sell off real estate so that you can cash out that way, then you may be successful as a private equity investor, but you are not providing healthcare. In fact, you are not capable of providing healthcare. You have no interest in providing healthcare. Your interest is in taking profits, and you put doctors and nurses and other medical providers in impossibly compromised positions because their duty is to provide healthcare. And I want to just make a statement about the Prospect Medical Holdings bankruptcy, because there's been some discussion today about how that is really a failure, but that is the intended result of private equity's ownership. That is evidence of their success, that they have successfully taken value out of healthcare providers and now can run away by putting them into bankruptcy. And so I really want to commend the committee for considering this, because I fundamentally think that this bill raises a moral question, which is whether or not here in Connecticut we're going to subject patients and communities to healthcare purportedly provided by entities that have zero interest in actually caring for them. And so I understand, actually, from listening to the conversation tonight, that there have been some concerns about MSOs. And from my perspective, if MSOs are involved in independent healthcare practices and do not have a controlling stake, they may present different risks, but not the systemic risks that we're talking about when it comes to private equity ownership of healthcare systems. And so I really want to commend this committee for taking a moral stand in response to the Prospect Medical Holdings failures, because this is no way that we should be providing healthcare, especially to vulnerable communities in our state. So thank you very much.
Thank you, Mr. Matty. You anticipated one of the questions that I had for you, which was to comment on the testimony that you have heard as you've been sitting here with us about the MSOs and the difference between those independent practices and hospital systems.
Yeah.
Did you want to say a little bit more about that?
Well, first of all, I do think that we should be promoting and supporting the independent practice of medicine in our communities. And I do think it's true that those independent medical groups can struggle with some of the back office management of their practices. I think where MSOs are offering fee for service models, that's probably the best way to go about it. Where they are offering those services in exchange for a minority ownership stake, I think it does require some more scrutiny, because sometimes those contracts involve succession planning, which means that once the doctors decide that they want to move on or no longer operate the practice, those private equity investors can take ownership, in which case you would see the same incentives play out. But I do agree that those types of relationships, so long as they are minority stakes, don't present the same systemic risks that we're seeing with hospitals or healthcare systems when they come under the control of private equity investors.
So one other question I have for you is something that I've said here is, not all investors are created equal, right? And in one regard, I am with you completely in terms of the basic premise of private equity is to create and generate and produce a profit for its investors, for its shareholders. But again, if you look at across the board at different institutions and organizations, they don't all necessarily approach that making a profit in the same way. So I know what you're saying is this across the board is not a good idea, but would you agree with that statement that essentially there can be differences in the way that people approach that?
Well, I think that the problem arises where the mission of the healthcare provider is different than the mission of the investor. So I think Senator Anwar was discussing earlier today university healthcare systems or not-for-profit healthcare systems, which have as part of their mission to provide quality healthcare to patients. Of course, there's no perfection in that, but at least that is the guiding principle underlying their mission. I think when you have private equity or kind of investment ownership stakes in hospitals, it is very hard to see how the healthcare mission aligns with what their duty to their investors is. And that I was reading earlier today that the private equity ownership group of Prospect Medical Holdings, shortly after it purchased Prospect Medical Holdings, purchased J.Crew. And it's very different when, you are looting J.Crew and, fewer T-shirts get sold. And certainly there are economic consequences for employees, but you do not have the kind of catastrophic human consequences that you have when the healthcare system is corrupted by that sort of profit-centered motive.
I agree in terms of the misaligned missions. That's part of why we're here. And I'm pushing because I think this will continue to be a difficult conversation. Many people have said to us, well, the horse has left the barn, right? That if we're not allowing access to private equity, then who's paying the costs? Won't costs just go up for the consumers? And so again, I'm playing devil's advocate with you just to hear your thoughts about that in terms of costs of care, which is certainly access, cost, quality of care, are things that we talk about all the time at this committee.
I think with the Prospect Medical Holdings, what those hospitals thought they were getting was a lifeline, and it was quite the opposite. They weren't getting a lifeline. They were getting dragged down underwater. And, now those communities are paying in a very different way.
And potentially, others may have to pay in a very different way. I mean, certainly we've had conversations here among legislators, looking for the state to provide support, I should say, and, the tens of millions of dollars. Not that we're there at this point, given the bankruptcy court, but yes, I appreciate you being here and testifying and taking the time to do so.
Thank you.
Senator Omar.
Thank you so much, Madam Co-Chair. Thank you so much for your testimony and being with us this late afternoon and evening. Question for you is, the private equity at times are playing all sides. They also are investors in the insurance industry. They're trying to be investors in the delivery of healthcare, and they're also investors in everything else that may touch, including real estate in the picture. So they're making money no matter what's happening, and it's pretty strategically done. So I appreciate your support of the bill with respect to this part, but do you want to expand a little bit about how they're doing various things in the state in different arenas and completely destroying the values we live by in our state?
Well, I mean, private equity has been around a long time, and I mean, it really is their modus operandi to identify distressed assets take the value out of them and then abandon them, and leave, devastated communities and workforces in their wake. And, unfortunately, that type of kind of commercial activity is opportunistic and not always unlawful, but it has terrible consequences. And I think your job and, the job of other policymakers is to have transparency around those transactions and to identify industries in which those types of transactions are just so fundamentally incompatible with our ability to care for our communities that they just should be disallowed.
Can I also ask you, is the systemic issues that you've talked about, how are the manifestations that you are seeing when you hear about some of the situations develop?
Yeah, I mean, when private equity comes in and tries to suck value out of the hospital systems, what that means is that they're short-staffed. It means that they let their physical facility go to disrepair, creating increased risk of infections. They cut back on training. They don't invest in really anything that can improve the quality of care because that doesn't result in short-term returns. And they turn away patients. And so all of this creates the picture of a financial firm masquerading as a hospital. It is not a hospital. It is a financial firm. And in those situations, both patients and doctors and nurses really become widgets in a financial enterprise, not consumers of healthcare or providers of healthcare.
Thank you for your testimony. And what kind of bills can this committee put forward to see more of you?
Oh, I don't know. I don't do a ton of public advocacy around this. The Judiciary Committee, I think, is, but whenever I do see something that I really came here partly to commend the committee for taking a bold stance here. So I'm grateful for the opportunity.
Thank you so much. Thanks for being here.
Thank you very much, Mr. Matty, just making sure no one else has any other questions. Oh, he's ready to run. It looks like you're good, but I also just want to add my thanks for you engaging in this conversation. And we heard the word existential in some of the other testimony, but I do have one other question for you. Sorry. Actually, thank you. Two other questions. Do you have any written testimony that you are planning to submit or just verbally here today?
Yeah, I did not prepare written testimony.
Okay, thank you for that. Then the second question is, you're talking about healthcare in particular, but as you and so many of us here are aware, we're seeing private equity enter spaces such as autism services, childcare, housing. How would you differentiate the healthcare space from the others? And nursing homes, obviously, that's another area which is part of healthcare, but I know it's an issue everywhere, but would you differentiate? And if so, how would you differentiate?
Well, everything you've described, I think of as kind of critical human infrastructure. And so when it comes to things like housing or childcare or autism treatment, to me, we're talking about vital human needs. And while the government can't provide for every vital human need, I do think that we need to be attuned to the possibility that actors who do not have as part of their critical mission fulfilling those human needs are just not going to. So I think that the risks are similar, perhaps not as kind of immediately catastrophic and threatening to human life as you're seeing in healthcare, but people living in dilapidated housing with an unresponsive landlord who has zero interest in investing in those properties also face real hazards. Children who are, subject to the care of private equity funded enterprises who don't have an incentive in providing highly trained, background check people, also face similar risks. So I think it comes down to this same issue of mission alignment and there being a real disconnect there, especially when the private equity owners don't have any connection to our state or our community. They don't see us as their neighbors. They don't see the kids or their tenants as their neighbors. That's not the way they look at the world.
The connection to community, the connection that we have to one another. It's really critical. I will not ask you about 6873, but you may hear from me offline to talk a little bit more about the governor's bill related to this topic as well. But thank you very much for being here with us.
You're welcome. Any other questions before I?
No, you're good. You are truly free to go now, and thank you.
Nice to
We
see you.
appreciate it. It's great to see you too. Next, I believe, actually, I'm not positive. Do we have Allison Logan here? Is Allison here?
Yes, I'm here online. Can you hear me?
Yes, Allison, go ahead.
Good evening, chairs and members of the Public Health Committee. I'm Allison Logan, co-founder of the CT359 network. I'm testifying today in support of House Bill 7214, an act concerning maternal health. CT359 is a network of over 80 individuals and organizations focused on the health, well-being, and early success of Connecticut's younger children within the context of their families and communities. Members gather, analyze, prepare, and share vital information on family and child outcomes to help people, organizations, and government make sound policy and resource decisions. Recently, CT359 released a policy advisory focusing on the data surrounding perinatal health and mental health in Connecticut. We have submitted written testimony with references and links to this advisory and multiple additional data reports. The maternal health crisis in the United States, and particularly in Connecticut, disproportionately impacts Black and Brown communities. Between 2018 and 2020, non-Hispanic Black parents in Connecticut experienced the highest rate of severe maternal mortality, more than double that of non-Hispanic white parents. Additionally, the Connecticut Maternal Mortality Review Committee reports that nearly 9 in 10, or 88%, of pregnancy-related deaths in Connecticut are preventable. These disparities are unacceptable and highlight the urgent need for systemic changes in maternal health care in our state. Also, recent data reported by the CDC indicates that 30% of Black, Hispanic, and multiracial mothers reported experiencing mistreatment and discrimination during pregnancy and childbirth, including being ignored by healthcare providers and having requests for help refused. While this clearly is a problem for all of America, it is a stunning problem for Black and Brown women and babies in Connecticut. This is a systemic issue. We need to move towards prevention, and the components of House Bill 7214 are some of the first steps. One of the key provisions of the bill is the establishment of a report card for hospitals and freestanding birth centers. This level of transparency is critical in holding institutions accountable for the quality of care they provide, with assistance for facilities that perform poorly to implement strategies allowing midwives, doulas, and perinatal professionals to work together to improve outcomes. This kind of standard report card system would help identify gaps in care and ensure equitable treatment for all birthing individuals. The bill also proposes the creation of an advisory committee to study and promote doula-friendly practices in hospitals. Research confirms that the presence of a trained doula leads to lower rates of surgical births and interventions. However, doulas often face systemic barriers in hospital and clinical settings, limiting their ability to provide continuous support. Lastly, the establishment of a task force to study perinatal mental health care is necessary and long overdue measure. So many cases of mental health conditions go undiagnosed and untreated. A dedicated task force will help identify gaps in services, recommend culturally responsive mental health interventions, and ensure that comprehensive support is available to all families. I and the members of CT359 strongly urge you to support House Bill 7214, as it is a necessary step to ensure that all birthing families in Connecticut receive the safe, dignified, and equitable care they deserve. Thank you very much.
Ms. Logan, thank you. Well done in 3 minutes. You got a lot in there. And thank you for your advocacy and for being here to testify on the
Of
bill.
course.
Next, we will go to Liz Gustafson, who's here with us in the room. Welcome.
Good evening, everyone. Senator Anwar, Representative McCarthy Vahey, and distinguished members of the Public Health Committee. My name is Liz Gustafson, and I am the Connecticut State Director with Reproductive Equity Now. Thank you for the opportunity to testify tonight in support of HB 7213 and 7214. As a state and regional organization, Reproductive Equity Now works in Connecticut and across the New England region to make equitable access to the full spectrum of reproductive health care a reality for all people. In the nearly 3 years since the United States Supreme Court issued a decision in Dobbs v. Jackson, and economic, public health, social, and racial justice only continues to grow, as 19 states have taken action to severely restrict or entirely ban abortion. OBGYN physicians have been sounding the alarm on the negative impact the Dobbs decision has had on maternal health and patient safety, particularly racial and ethnic inequities in maternal health, management of pregnancy-related emergencies, and pregnancy-related mortality. At the same time, federal and state efforts to undermine young people's ability to exercise their bodily autonomy have only increased. And we continue to witness attempts to restrict young people's access to birth control, comprehensive sex education, and the ability to access pregnancy-related care and more. As these efforts continue across the country, Connecticut must reaffirm its commitment to ensuring young people can access the care, resources, and support that they need. We are grateful that our state statute already includes protection for minors' ability to confidentially consent to a range of healthcare and services, but current statute lacks specific and explicit protections for a minor's ability to consent to contraceptive care and pregnancy-related care. The reality is absence of these explicit protections threatens the health, safety, and dignity of young people and compounds existing barriers and delays to accessing that care. HB 7213 is a common sense and necessary statutory clarification. Additionally, amidst the increasing maternal mortality crisis and threats of maternity ward closures across the state, it is critical that we implement measures to increase equitable access to quality and safe maternal health care and ensure transparency and accountability of facilities providing this care. That is why we also support HB 7214. So in closing, everyone, regardless of age or circumstance, should be able to access the contraceptive and pregnancy-related care that they need or that they want without facing arduous legal, logistic, or political barriers. So Reproductive Equity Now urges this committee to support HB 7213 and HB 7214. Thank you so much.
Liz, thank you for being here all day with us and for your testimony and advocacy today. Representative Zupkis.
Thank you, Madam Chair. Thank you for coming and staying, and missing corned beef and cabbage. So, a question, because you're the last speaker on this issue, I think, but, does your, I don't know if it's a facility, organization, do y'all perform abortions?
No, we are not medical providers. We are advocates.
Okay. Well, I had 2 questions for you, but, I don't think they're for you. Thank you. Thank you, Madam Chair.
Thank you, Representative Zupkis. Seeing and hearing no other, Representative Parker.
I just want to get on the record as a member of this committee. It's nice to see you all tonight. Thanks for the work you've done. And thanks, Liz, for your testimony, your advocacy. Appreciate what you shared. Thank you, Madam Chair.
Thank you very much, Mr. Chair of Environment. We know you were busy all day too, so thank you. Liz, thank you for being here with us. Okay, next we have Rosanna Ferraro. Is Rosanna with us? Yes, Rosanna, welcome.
Hello, I'm Rosanna Ferrara. I'm the Policy Director at Universal Healthcare Foundation of Connecticut. I am really excited to be able to finally speak with y'all. We are here in support of 7213, 7214, and 1507, so I will be very brief. I really want to focus on the maternal health report card. I'm very fortunate. I come from a family of 6 children, and my mother had healthy pregnancies and deliveries. So I don't think I appreciated quite the scope of this crisis until I remember very clearly hearing the story of the amazing Serena Williams and her birth experience, where she was not listened to, and it was only through her own self-advocacy that she's actually alive today. What that brought home for me was, if a woman as famous, as rich, as well-known as Serena Williams can't get appropriate maternal care, how are other birthing people of color going to be able to access the care they need that's culturally appropriate without some sort of transparency, accountability, or a report card? I believe very strongly that what you don't measure, you can't really address. And I think the report card creates a way for us to measure the quality of care. I want to speak briefly on 7213. We stand in full support of both Reproductive Equity Now's position and Planned Parenthood of Southern New England's position on this bill. We have seen the way the federal landscape is turning, and we think it's important to make sure that we are doing everything we can in this state to ensure access to reproductive health, regardless of your age. The last thing I want to say, and I actually think that others have said it more clearly about 1507 and private equity in healthcare, but we wholeheartedly agree that private equity does not belong in healthcare, essentially because it is incompatible, which I know folks have already said. So we just want to echo that. I will say, when I started at the foundation 11 years ago, the first thing I worked on was the tenant's proposed acquisition of the Waterbury and the other hospitals. And we've been saying from that point that we were very concerned about any private ownership of hospitals, and that nonprofit hospitals had a different kind of responsibility to community. So I just wanted to add that level of that little remark. Other than that, I urge you to support all 3 of these bills, and I hope you have a lovely evening.
Thank you so much for staying with us today and for your support and your testimony here today. And we hope you have a great evening also.
Thank you.
Next, we actually have number 7. You may recall, Dr. Carney switched with Dr. Martis, who is here with us now. Dr. Martis, welcome.
Hi, I am, can you hear me?
We can hear you, but we cannot see you. So if you're able to turn on your camera, we would.
You got me now.
Great, thank you.
Well, good evening to all of you. And first, I would like to say thank you very much for having me this evening. And very quickly, thank you for the patience that you have shown all of the people presenting this evening and throughout the day. You seem to make everyone the focus of your attention, and I think you're doing a great job. So I thought that you should hear that from me. So thank you. Senator Anwar and Representative McCarthy-Vehí and all the esteemed members of the Public Health Committee. My name is Dr. Yvette Martas, and I am a resident of Columbia, Connecticut. I am also the chairperson of the Board of Directors for the Hispanic Health Council. I am testifying today in support of the House Bill 7214 and that concerning maternal health. House Bill 7214 aims to tackle racial disparities in maternal health care, but more especially, it will do so through the voice of the women who are receiving the care. I have spent greater than 30 years providing health care for women through my career as an obstetrician and gynecologist. 17 of those years have been spent here in Connecticut at Windham Hospital and Manchester Hospital. I have witnessed good care with sadly bad outcomes, but more tragically, I've also witnessed poor care with bad outcomes. When I speak of these experiences, I'm emphasizing the care that is provided for women of color as well as poor women. When a person enters our care, there is an unspoken agreement that we will be providing good care. They listen to us, and we in turn will take care of them. However, that experience should include not just a patient listening to us, but also us listening to the patient and her concerns. When there is a breakdown in this process, we ultimately arrive at the preventable component of poor outcomes. The active component is the deafness of the system currently has to the concerns of the women of color and poor women. I'm going to share an experience with you. JF is a 33-year-old recent graduate with master's in education, an Afro-Latina female who arrived to the labor floor complaining of headaches, abdominal pain, and not feeling well. The baby is monitored and appears to be okay at 29 weeks of pregnancy. Her blood pressure is borderline elevated, and her blood work is normal. She's discharged to home to rest, and 24 hours later, she returns to the labor floor again with the same complaints, but this time adding fatigue. Because she had been seen the previous night and her blood pressure was about the same, and the baby's monitoring was normal, she was sent home again. 2 days later, her husband calls the service and reports that his wife is seizing. An ambulance is called and the patient is taken to the nearest hospital where her blood pressure is now elevated and she has the complications of needing to have a delivery of her 29-week fetus for HELLP syndrome, which is a spectrum of preeclampsia. She undergoes an emergency cesarean section. A placental abruption, which was the cause of the abdominal pain, is diagnosed. Her baby boy survives the delivery but required life support interventions. He died 30 days later, never having left the NICU and only held by his mother to the NICU incubator hand opening. This patient was not under my care at the time of the event, but I've seen her now for 10 years, and she's not been able to get past that experience or ever return to that hospital. She's an educated woman, and she and her spouse were clearly aware that their concerns had been dismissed. They did not pursue litigation because nothing would bring back their baby.
Excuse me, Ms. Martis, but I'm sorry, you've reached your 3 minutes. Thank you.
Summary, thank you.
Dr. Martis, please finish. Thank you.
So in summary, I'm supporting this bill and I urge you to support it because House Bill 7214 will give the voice to the system of the women actually experiencing these outcomes. And this is the way that we will address the social determinants of health. Thank you.
Thank you, Dr. Martis. And I think as many of us are here, hearing the story that you shared, it's crushing to hear that. And I was very struck by what you said, that the deafness the system has for women of color. So I appreciate you spending the time, and your words have had an impact. Thank you for being here with us.
Thank you very much.
And seeing and hearing no other questions, I believe, is Tom Gilberti here? And no, I don't think so. Okay, with that, Mr. Peter Dreyer. Is Mr. Dreyer here? Here. Welcome.
I'm here. Last and least, I guess, for the evening. Happy St. Patrick's Day. Good evening, Senator Anwar, Representative McCarthy Fahey, and distinguished members of the Public Health Committee. My name is Peter Dreyer, and I am the president-elect of the Connecticut Trial Lawyers Association and a managing partner of Silver, Golub & Titel, whose principal office is in Stamford. I've practiced law in Connecticut for over 25 years, focusing on wrongful death and serious injury cases, including medical malpractice cases, and previously served as a prosecutor in the Bronx District Attorney's Office. I strongly oppose Senate Bill 1508 because it unfairly increases costs for patients seeking access to their own medical records. I know CTLA has submitted written testimony opposing SB 1508, but I wanted to highlight a few key points. First, this bill unfairly treats the elderly, the poor, and the less educated. It's a threshold matter when an attorney representing a patient requests that patients own medical records, the patient pays the cost. Patients either reimburse their attorney or have the cost deducted from their recovery. So the charges still fall on the patient even when their attorney requests them. And many clients struggle with medical record request portals and forms. Those who can navigate them tend to be more educated, tech savvy, have reliable internet, and the flexibility to follow up during business hours. They can avoid the excessive fees in SB 1508, but those without those advantages must rely on an attorney, meaning the least resourced patients end up paying the most for their own records. And that's fundamentally unfair. And second, the fees in this bill are extreme and ignore the difference between electronic and paper records. Under federal law, providers can charge patients $6.50 or their actual documented costs for providing the records. But patients, in my experience, are almost always charged $6.50 for electronic records. If producing records is so expensive, where's the itemized invoice? In reality, retrieving electronic records is not as complex and expensive as claimed. Yet this bill treats it as if clerks are still manually searching file rooms. Other states have far lower fees. New Hampshire has a law that went into effect last year where paper copies cost $5 for the first page, 41 cents for pages 2 through 50, and 30 cents beyond that. That's far more aligned with the real costs. For electronic records, New Hampshire has capped the charges at $50, and other states have similar caps. Nevada is $40, New Jersey is $50, Ohio is $50. Why should Connecticut patients pay more than those in other states? Patients should not be penalized for how they obtain their medical records, whether they request them personally or through an attorney. The cost should be the same. SB 1508 creates financial barriers to justice, and we would make Connecticut an outlier in the country for medical record fees. I strongly urge this committee to oppose Senate Bill 1508 and protect the rights of Connecticut patients. And I thank you all for this long evening, which I know is very long for you. And I thank you for your time and consideration. I'm happy to answer any questions you have.
Mr. Dreyer, thank you for hanging in there. Believe it or not, there are still 2 more people after you, so you are not the finale tonight.
I thought I was. I'm sorry.
No, we appreciate the input that you have provided and look forward to more conversation on this bill. I believe Rep. Carpino earlier had raised some questions, and I think we will have ongoing conversations. So thank you for being here with us, and happy St. Patrick's Day.
Thank you.
Next, we have Tom Gilberti and followed by Eleanor Berguna. Mr. Gilberti, welcome.
Thank you so much. Thank you, co-chairs McCarthy, Vahey, and Anwar, ranking members Claire Destitri and Summers, and distinguished members of the Public Health Committee. Thank you for the opportunity to testify. My name is Tom Gilberti. I am president of the Southern Connecticut State College Democrats. However, today I am testifying as a private citizen in support of SB 1507. Me and my family currently resides in Middlebury, right down the street from the Waterbury line. Because of this, for years, my family has relied on the care from the wonderful staff at Waterbury Hospital. But as we all know, this resource that many residents have been relying on for years may not be with us for much longer. Waterbury Hospital serves hundreds of thousands of people per year, and yet the owners of it treat nurses as essentially money generators. Staff at Waterbury Hospital reported for a while that their conditions have been worsening ever since the Prospect takeover. In fact, conditions are so bad that state investigators found that staff were using rusty equipment in operating rooms. The fact that it took state intervention to find this out shows all you need to know about the leadership of the owners of Waterbury Hospital. But unfortunately, this is just not a hospital exclusive issue. You have probably seen John Oliver's piece on hospice fraud. But for those who haven't, let me fill you in on the story of Patricia Marble, a woman who was in hospice on the recommendation of her healthcare provider. This woman would go on to be held in hospice for 5 years with her medication list, including drugs like morphine and fentanyl. This is all despite the fact that during her entire time at the healthcare facility, She was reported by family as being in very good health and was only able to be released after her children essentially snuck her out because the facility did not want to release her. The fact of the matter is we need intervention on this issue to prevent other Patricia Marbles from going through this. We also need this to help an already overstressed medical worker population. According to a study from Harvard, hospitals that were acquired by by private equity firms experienced a 25% increase in healthcare complications from their patients. Heck, I came across a study from the National Institute of Healthcare Management that stated over 90% of private equity takeovers aren't even reviewed. For too long, these private equity firms have gone away with putting people over profits, profits over people. Before I end real quick, I would like to state for the record that I also support HB 7213 and 7214. We need to provide access for reproductive health care to as many people as possible and make sure we continue to provide quality care for all nutmakers. Thank you for your time and consideration.
Thank you so much for being here with us today. We appreciate your testimony before the committee. Have a great rest of the evening.
Thank you.
Next, we have Eleanor Perguna. There may be one more, just so committee members know. I'm welcome.
I promise I will make this brief. Well, in the 3 minutes. Good evening, chairs and members of the Public Health Committee. My name is Eleanor Farraguna, and I'm a resident of Windsor, Connecticut. I want to extend my respect and grace for you all and your patience here today. I know I've made many breaks out of this room, and you all have to stay here, so I really appreciate you hearing all of this testimony today. And I'm honored to speak in front of you. I'm a doula student and am testifying in strong support of House Bill 7214, an act concerning maternal health. Maternal mortality has been studied globally, nationally, and within our own state, and findings continue to show that over generations of women, disparities exist in our healthcare systems. That's not why I'm here today. We know that Black women and women of color are dying in our country and in our state specifically during pregnancy, birth, and postpartum. And we know the vast majority of these deaths, as we said in earlier testimony, are preventable. We know this, but let me correct myself because Black women and women of color know this. And the rest of us, particularly the white people, get to learn this in committee hearings like this, right? We get to learn this from the experience of others. We are not experiencing it ourselves. And we get to go home to our children alive. This is not a luxury afforded to everyone here. So I want to use my time here today to ask about your bottom line. I think that's been said, that phrase, a number of times today, your bottom line. And I want to ask specifically, what is the bottom line? Because I know where I stand outside of this building, and I know what steps I am taking to keep those in my life alive. I've had the extraordinary pleasure to be welcomed into the homes, hearts, and lives of women of color. So I know that this work has urgency because I will not allow my family to be harmed. The personal is political, and the political has become personal. The personal is a professor in college telling me her birth story, which took place in the hallway of a Connecticut hospital because the staff did not respond to her screams for help in time. The political is that she made it out alive while many do not. Maternal mortality is on the rise, and Connecticut has lost too many mothers for this conversation today to solely be about a reporting system to be implemented. The personal is learning the experiences of my doula sisters at hospitals in Connecticut, 40-hour labors, fetal monitor malfunctionings, and so many miscarriages. The political is it not being enough for us to make substantive change. The personal is a Black patient of mine, a Black patient changing her mind about wanting to terminate a pregnancy only to hear good luck from the white doctor before she left her room alone. The political is understanding that hospitals are to Black women as police brutality is to Black men. The personal is that my biggest fear is losing my best friend to the healthcare system when she decides to start her family. So I ask again, what is your bottom line? The bill will require hospitals and healthcare providers to investigate their current policies and procedures and make necessary changes that will ensure women of color have births free of trauma and can return home with their children. If this is all I can ask of you today, then I will. Please remember your humanity and the humanity of those who will be impacted by this and vote to support House Bill 7214. Thank you for your time.
Eleanor, thank you for staying here with us and
Mhm.
sharing your passion and your testimony and your advocacy on behalf of so many people who have struggled to
Thank you.
receive the care that they need.
Thank you.
Thank you. Seeing and hearing no comments. Ladies and gentlemen, I believe we have one more person here to testify. We have, I see now who is here in the room. I think, thank you to our team who got her the right link and got her here. We have Mona Colwell. Welcome. Mona, unfortunately, we cannot hear you. So you are here, but need to adjust your microphone setting, I believe. Pause for technical issues. And Mona, we still cannot hear you. We can't hear you still. So Mona, unfortunately, we are not able to hear your testimony tonight. We see that you have come to share testimony, and we hope that you can submit written testimony if you haven't done so already. Are you able to do that? I see you nodding your head yes, but I can't hear what you're saying. So yes, we will take the opportunity to review your written testimony, and I'm sorry that we're not able to hear you tonight. Thank you for making the effort to be here. Okay, committee members, with that, our public hearing, our St. Patrick's Day public hearing is complete. And I want to thank especially all those who are behind the scenes, our team upstairs and here in the room, including CTN, our clerk, our assistant clerks, our administrator, and everyone who helps us get through the day and makes this happen. Thank you all. Have a wonderful night and safe journeys home.